So the very first practice we're going to do, I want you to put your hands onto your belly, and cup your belly. So the little fingers, are right down the bottom of the belly, just above the pelvis. Just holding on there gently. And then from there, you can just simply breathe into the hands, like you're breathing a balloon, and out breath. And the belly's going to come in a little bit. Now, I say that, but for some people, their body has learnt to breathe up here, so the in-breath is up here. Now that's going to have physiological aspects to it that can actually get quite problematic. So if you're what's often called a reverse breather, if you're breathing up here with your in-breath and the belly doesn't move very much, I'm going to really encourage you, maybe rest one hand on the chest, but certainly one hand on the belly, and see if you can start to turn that around to get this breath. The belly coming out here, flattening the diaphragm. The diaphragm is the big respiratory muscle, that runs from inside these ribs here. It's like a dome structure with muscles coming up and a tendinous sheet inside, and that dome flattens out on the in-breath. So when that dome flattens out on the in-breath, the natural or more natural way of breathing is simply for the abdominal contents to come out, and that's your in-breath feeling like it's breathing into the belly here. And then that out-breath, belly comes in, diaphragm lifts up again, goes back up into that dome shape. So this diaphragm is doing this as the belly comes out. So we've got this kind of pattern happening here like this. Out breath. In breath. Now this is a very simple way of breathing. So very easy, and we want to keep it effortless on this practice. So it's effortless belly breathing, abdominal diaphragmatic breathing. Now, for some people, again in the modern world, there is a tendency for people to want to have flat bellies. It's considered fashion to have your belly really tucked in and tight, often for women as well. And what that does oftentimes is, if you've got that belief that you need to have a flat belly or you won't be loved, your breath is likely to become chest breathing up here. So we need to learn to relax that belly. And this opportunity here is really to relax the belly, drop right into those belly muscles, soften them out on the inhale. We're going to do another practice that is related to this, but for now, just see how much you can get into that belly breath if you can. That diaphragm is going to flatten out. The belly is going to expand outwards as that pressure of the diaphragm comes down. And if you feel into what your pelvic floor is doing, the muscles of the pelvic floor, and the muscles of the pelvic floor are like a diamond like that. So you've got the sit bones on either side, you've got the pubis at the front, and the tail at the back. And those muscles, when the diaphragm pushes down, will just ease down in towards the floor. And they are responding to the diaphragm. So as the diaphragm comes down, the pelvic floor goes down. As the diaphragm lifts back in on the exhale, the pelvic floor lifts slightly. So there's a dynamic relationship between the pelvic floor and the diaphragm, and also with the belly muscles. So this belly breathing is very simply relaxing the whole of the abdominal structure, and with it, the mind. I want you to do about 9 breaths like this, 9 to 12 breaths. And then just hold your breath gently. Hold your breath. Just breathe out and hold your breath. When you hold your breath out like that, I want you to start to notice what's happening inside of you. What's happening? Are there sensations in the body? Are there feelings in the body? Because something's going to happen. Your diaphragm is going to want to start moving quite quickly, and that's going to be initiated by the brainstem, the structures at the bottom of the brain just above the spinal cord, where the spinal cord joins into the back of the head. And those structures, the medulla and the area around the base of the brain there, those areas are making you breathe in. And they're responding to the amount of carbon dioxide, which is the gas I'm going to talk about in a minute, the carbon dioxide in the blood. And when that carbon dioxide gets to a certain level in the blood, your brain is measuring that, and it's going to want to breathe in. It makes you breathe in. So that comes out as feelings in the body. And what you feel is maybe a slight sense of panic, and your diaphragm beginning to move, it begins to pulse. So what I want you to do is we're going to do this breath again, and you're going to feel into the body and just notice when you get those first signs, those first physiological symptoms of the brainstem saying, breathe in. Okay? So take a couple of belly breaths again. And then just hold the breath out gently, really gently hold. And just notice what happens. Notice, when you get those first physiological symptoms of the body breathing in, so you can spot them. Great. Now, there's no willpower here. We're not trying to hold our breath out. We're just holding the breath. No willpower. It doesn't matter how long it is. Just checking it out. Just finding out what's happening. Because the first part of it is we just have to find out. We have to find out, okay, what's happening here? There's no point in dramatically trying to change something when we don't even know what's true or real for the system at this point in time. Okay? Great. Now, let's do that again. Let's do another few breaths here, another 9 breaths or so. And remember, if you're working with changing the chest breathing down, give yourself time to do that. You're going to need a daily practice of changing that upper chest breath into a belly breath. Probably need a few days of doing that. So if you've got that going on in your body, if your body has learned to breathe like that, and everybody's body learns to breathe. When we were in the womb, we didn't breathe. When we come out, we learn to breathe. We take the first breath. That's an immense breath. There's a huge amount going on in that because the lungs are opening for the first time. The hole in the heart, which divides which opens up the space between the ventricles at the bottom of the heart, has to close so the blood can go up through into the lungs, into respiratory circulation, down the other side, and then around the body. So all that has to happen on that first breath, or pretty much the first breath. So we come out into the air from being in that aqueous environment, that watery environment of the womb, and come out and take that first breath. And there's a huge amount physiologically going on. And the brain hasn't learned to breathe yet. So we have to entrain the system in breathing, and we entrain ourselves by tuning into the mother's breath. We listen to how our mother breathes. Our body listens to how our mother breathes. And our body learns how to breathe from the mother, from our mother. And then every single life situation that happens after that, when we get stressed or we get emotionally upset, again, we're going to talk about this later, we are training our breath systems because we manage those complexities with different ways of breathing. So when our body has learned to breathe up here, we have to slowly change it round so we can get the abdominal breath working down here. So if you're one of those people, just be patient with yourself and do a number of breaths every day, 3 times a day, just doing this abdominal breathing, getting that practice in, making sure your chest is still and calm and your belly is breathing. And if you've got that reverse breathing on, this is one of the best things you can do for your health and well-being right now, is to change that pattern around. So be patient and stay with it. Great. If you are doing these 9 breaths now, Again, we're going to start counting now, so you can have a timer to hand if you want on your phone or on a device of some kind. Or you can just count in your head. Yeah? And the counting in your head is going to be very simple and very slow. It's just 1 and 2 and 3 and 4 and 5 and 6 and so on. Okay? So we can take those 9 breaths and just hold the breath out again. And just notice how long it takes for those first symptoms of needing to breathe in before they start. Let's take 1 more breath and hold the breath out now. And that's 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9, whatever it is for you, and 10 and 11 and 12 and 13 and 14 and 15. Don't push it, no willpower, and 18 and 19 and 20. Now, it's most likely you've breathed in already. Yeah, that's normal, and it's okay. So most people get around about 10 seconds on that. Yeah? If you're a trained athlete, you might get to 20. If you're a super trained athlete, you might get to 40 seconds. Might do, but you might not. Because sometimes people train their systems in the wrong way. So I want you to check in your breath school. And what I want you to do now is to go away and just do some brief practices during the course of the day where you're doing some gentle belly breathing. It's effortless. And soft holding, and just notice how it is to hold for a little while and notice the physiological symptoms. And breathe in from there and start to work out how long that space is. What you can also do is you can do some gentle walking practice where you're walking along the road, belly breathing, and just gently hold the breath for a few steps. And start to stretch your capacity to hold that breath a little bit more. We're going to talk about nose breathing and mouth breathing, and a little bit more about carbon dioxide and oxygen, and how that affects your mind state and your emotional state and your health. Okay? Beautiful. Thank you.